In recent discussions, Robert F. Kennedy Jr. has controversially promoted the use of vitamin A as a treatment for measles, claiming it can be an effective remedy for those already infected. While there is some evidence that vitamin A can aid in the management of severe cases of measles, particularly in children with existing vitamin A deficiencies, this recommendation comes with significant risks. The misuse of vitamin A, especially when administered in excessive amounts, can lead to toxic reactions with serious, even life-threatening consequences. This raises substantial concerns, particularly in light of the ongoing measles outbreaks and the increasing number of unvaccinated individuals. Vitamin A, when used therapeutically under careful medical supervision, can indeed help reduce the severity of measles in certain cases. The Centers for Disease Control and Prevention, CDC, acknowledges the role of vitamin A in supporting the recovery of children with severe measles. However, it is crucial to note that this intervention is intended to be a short-term, targeted medical treatment, not a general recommendation for everyone, and certainly not as a preventative measure. The idea that vitamin A could be a simple solution for measles disregards the complexity of the disease and the nuanced approach required for proper treatment. The risks associated with vitamin A toxicity are significant. Acute toxicity can cause headaches, nausea, vomiting, irritability, and abdominal pain, while chronic toxicity can lead to more severe issues, including liver damage, hair and skin changes, and fetal birth defects. The most alarming aspect of vitamin A toxicity is its potential to affect vital organs like the liver and cause increased intracranial pressure, which can lead to serious health complications. These risks are heightened when vitamin A is used without proper medical supervision or in doses higher than recommended. Despite these well-documented risks, Kennedy's promotion of high-dose vitamin A and cod liver oil as measles treatments has gained attention, particularly in communities with low vaccination rates. His framing of the measles outbreak as a not uncommon event and his focus on vitamin deficiencies rather than vaccination, however, ignores the broader public health context. Measles, a disease declared eliminated from the U.S. in 2000, is making a concerning comeback, primarily among unvaccinated individuals. The CDC has found that the overwhelming majority of current measles cases are occurring in unvaccinated populations, with 97% of cases involving individuals who are unvaccinated or have unknown vaccination statuses. Kennedy's suggestions may also contribute to confusion and fear around vaccinations, which have been shown to be highly effective in preventing measles. The measles, mumps, and rubella (MMR) vaccine is 93% effective after 2 doses, a fact that underscores the critical role of vaccination in preventing outbreaks and protecting vulnerable populations. The promotion of vitamin A as a preventive measure against measles, particularly without the necessary context or proper medical guidance, could potentially undermine efforts to increase vaccination rates and prevent further outbreaks. Moreover, there is an inherent danger in suggesting that vitamin A can replace or reduce the need for vaccination. Vitamin A may play a role in mitigating the effects of measles once contracted, but it should not be seen as a substitute for vaccination, which remains the most effective means of preventing measles. The CDC and health organizations worldwide continue to emphasize that vaccination is the cornerstone of preventing the spread of measles and other preventable diseases. The ongoing measles outbreaks in the U.S., particularly in states with low vaccination rates like Texas, further highlight the importance of addressing vaccine hesitancy and misinformation. It is concerning that leaders like Kennedy continue to promote controversial and scientifically unsupported treatments while downplaying the proven benefits of vaccines. As the country faces the resurgence of measles and other preventable diseases, it is crucial for public health messaging to remain clear, evidence-based, and focused on strategies that are proven to work, such as vaccination, rather than unproven and potentially dangerous alternatives. In conclusion, while vitamin A can be beneficial for certain individuals with severe measles who also have vitamin A deficiencies, its use should always be closely monitored by healthcare professionals to avoid the severe risks associated with overdose. Public figures promoting vitamin A as a general treatment for measles, particularly outside the bounds of medical guidance, risk putting vulnerable populations at unnecessary harm. Instead, the focus should be on promoting safe, evidence-backed practices, such as vaccination, which can prevent the spread of measles and protect public health.